Imagine waking up in a hospital bed, disoriented and confused, unsure of where you are or how you got there. The world around you seems alien, a distorted reflection in a funhouse mirror. This, my friends, is the terrifying reality of delirium, a sudden and severe disturbance in mental abilities that affects millions worldwide. Delirium is often shrouded in silence, mistaken for dementia, or simply dismissed as a normal part of aging. Yet this misconception couldn't be further from the truth. Delirium is a serious medical condition, often signaling an underlying health issue that requires immediate attention. Studies reveal that delirium affects up to 50% of hospitalized older adults, particularly those undergoing surgery or battling severe illnesses. Despite its prevalence, delirium remains largely misunderstood, its complexities often overlooked. But it's time to break the silence. It's time to shed light on this silent epidemic, to understand its causes, recognize its symptoms, and advocate for timely diagnosis and treatment. To truly grasp the impact of delirium, we must first understand the delicate balance that governs our minds. Our brains, those intricate networks of neurons firing in perfect harmony, are responsible for our thoughts, emotions, and perceptions. Delirium disrupts this delicate equilibrium, throwing our mental faculties into disarray. It's like a sudden electrical storm in the brain, disrupting the flow of information and causing a cascade of cognitive impairments. This disruption manifests in a range of symptoms, from fluctuating levels of consciousness and difficulty focusing to hallucinations and delusional thinking. Imagine, for a moment, the world through the eyes of someone experiencing delirium. Familiar faces blur and distort, their voices morphing into unintelligible murmurs. This disorientation and confusion can be profoundly distressing, not only for the individual experiencing it, but also for their loved ones. Navigating the labyrinthine world of delirium is like wandering through a funhouse of distorted mirrors. One moment, you catch a glimpse of your reflection, a fleeting reminder of the person you once were. The next, your image fragments, replaced by a grotesque caricature that bears little resemblance to your true self. This constant shifting of perception, this blurring of reality and illusion, lies at the heart of the delirium experience. It's a disorienting and frightening journey, one that leaves individuals feeling vulnerable, confused, and utterly alone in their own minds. The familiar anchors of reality, time, place, and identity slip away, replaced by a swirling vortex of disjointed thoughts and fragmented memories. Imagine trying to hold a conversation, to express your needs, when your thoughts race ahead of your words, tumbling out in a jumbled mess. This is the daily reality for those living with delirium, a constant struggle to make sense of a world that no longer conforms to the rules of logic or reason. By understanding the causes of delirium, recognizing its symptoms, and seeking timely medical intervention, we can help guide individuals back to the shores of reality. Unraveling the causes of delirium is like untangling a complex knot, each strand representing a potential contributing factor. It's rarely a single culprit, but rather a confluence of factors that converge to disrupt the brain's delicate equilibrium. Infection, medication side effects, dehydration, sleep deprivation, pain, and even changes in surroundings can all tip the scales, pushing a vulnerable individual towards the precipice of delirium. Infections, particularly urinary tract infections and pneumonia, are common culprits, their inflammatory effects reverberating through the body and impacting brain function. Medications intended to heal and alleviate suffering can sometimes have unintended consequences, particularly in older adults with multiple health conditions. Even seemingly innocuous factors like dehydration, sleep deprivation, and changes in surroundings can contribute to delirium. Imagine being hospitalized, hooked up to machines, and subjected to a constant barrage of unfamiliar sights, sounds, and smells. Recognizing the early warning signs of delirium is crucial, as timely intervention can significantly improve outcomes and reduce the risk of long-term complications. However, identifying delirium can be challenging, as its symptoms often fluctuate throughout the day, waxing and waning like the tide. Sometimes the signs are subtle, easily dismissed as fatigue or confusion. One of the hallmark symptoms of delirium is a sudden change in awareness and attention. Individuals may appear disoriented, struggling to follow conversations, or losing track of their surroundings. They may drift in and out of consciousness, their eyes glazed over one moment, then startlingly alert the next. Another telltale sign of delirium is disorganized thinking. Individuals may jump from one topic to another, their thoughts fragmented and difficult to follow. Hallucinations, while not always present, are a particularly distressing symptom of delirium. These sensory experiences, often visual or auditory, feel disturbingly real to the person experiencing them. Diagnosing delirium can be challenging, as there's no single test to confirm its presence. It requires a skilled clinician, often a geriatrician or neurologist, to piece together the puzzle, considering the individual's medical history, current medications, and clinical presentation. Treating delirium effectively requires a multi-pronged approach that addresses both the underlying medical condition and the symptoms themselves. If an infection is identified as the culprit, prompt treatment with antibiotics is essential. Similarly, if medication side effects are suspected, adjusting dosages or switching to alternative medications may be necessary. Creating a calm and supportive environment can go a long way in reducing agitation and confusion. Orienting cues, such as clocks, calendars, and familiar objects, can help ground individuals in reality, providing a sense of familiarity and stability. Non-pharmacological approaches, such as music therapy, aromatherapy, and gentle massage, can also be beneficial in promoting relaxation and reducing anxiety. Behind the medical jargon and diagnostic criteria lie real people grappling with the profound impact of delirium. Their stories, woven with threads of fear, confusion, and resilience, offer a poignant glimpse into the human cost of this often overlooked condition. Imagine a loving spouse witnessing their partner's sudden descent into delirium, their shared memories and cherished moments fading into the fog of cognitive impairment. One story that deeply resonated with me is that of a retired teacher, Mrs. Smith, who developed delirium after undergoing a routine hip replacement surgery. Once a vibrant and independent woman, she became withdrawn and disoriented, her normally sharp mind clouded with confusion. She struggled to recognize her own children, accusing them of being imposters, her words laced with fear and suspicion. Witnessing their beloved mother's transformation left her family heartbroken, their once unbreakable bond strained by the invisible hand of delirium. Another story that highlights the profound impact of delirium is that of Mr. Johnson, a retired firefighter who developed the condition after a severe bout of pneumonia. He found himself grappling with terrifying hallucinations, his hospital room transforming into a battleground, the beeping of machines morphing into the deafening roar of sirens. These stories represent the countless individuals and families touched by delirium, their lives irrevocably altered by this disorienting and often frightening condition. While the experience of delirium can be deeply unsettling, it's essential to remember that it's often reversible, particularly when diagnosed and treated promptly. The road to recovery may be gradual, requiring patience, understanding, and a compassionate approach to care. For many individuals, the first step towards recovery involves addressing the underlying medical condition that triggered delirium. As infections clear, medications are adjusted, and the body begins to heal, the fog of delirium often begins to lift. Cognitive function gradually returns, albeit sometimes at a slower pace, with individuals regaining their ability to think clearly, communicate effectively, and engage meaningfully with the world around them. Rehabilitation plays a crucial role in the recovery process, helping individuals regain lost skills and adjust to any lingering cognitive or functional impairments. Occupational therapists can assist with regaining independence in daily activities, such as dressing, bathing, and cooking. The emotional toll of delirium should not be underestimated. Individuals recovering from this disorienting experience may experience lingering anxiety, fear, or depression. Despite its prevalence and potentially devastating consequences, delirium often remains hidden in the shadows, misdiagnosed, misunderstood, and undertreated. It's time to break the silence surrounding this silent epidemic, to raise awareness about its impact, and to advocate for the timely diagnosis and treatment that can make all the difference. Educating healthcare professionals, particularly those working with older adults, is paramount. By equipping doctors, nurses, and other healthcare providers with the knowledge and skills to recognize and manage delirium, we can improve early detection rates and ensure that individuals receive the appropriate care they need. Empowering patients and their families with information about delirium is equally important. By understanding the risk factors, symptoms, and potential complications of this condition, individuals can become active participants in their own care. They can advocate for themselves or their loved ones, alerting healthcare providers to any changes in mental status and ensuring that delirium is considered as a potential diagnosis. Public awareness campaigns can play a crucial role in dispelling myths and misconceptions about delirium. Imagine a future where delirium is no longer a silent epidemic, but a condition that is widely understood, promptly diagnosed, and effectively treated. A future where healthcare professionals are equipped with the knowledge and tools to identify and manage delirium, and where patients and their families are empowered to advocate for their own care. By working together, researchers, healthcare professionals, policymakers, patients, and families, we can create a world where delirium is no longer a source of fear and confusion, but a manageable condition that does not define a person's life. Investing in research is crucial to unraveling the complexities of delirium, identifying new treatment targets, and developing innovative interventions that can prevent, treat, and ultimately cure this debilitating condition. This includes exploring the potential of non-pharmacological approaches such as music therapy, aromatherapy, and sensory stimulation to complement traditional medical treatments. Ultimately, our goal should be to create a healthcare system that is not only equipped to treat delirium, but also to prevent it in the first place. This means addressing the root causes of delirium, such as infections, medication side effects, and dehydration, through proactive measures that promote overall health and well-being, particularly in older adults. A future free from delirium is a future where everyone, regardless of age or health status, can enjoy the full potential of their cognitive abilities. Subscribe and don't forget to take care of yourselves. Goodbye.